The most important aspect of the epidemic is the unequal mortality rate among the elderly. This allows the virus to spread almost undetected among the younger and less vulnerable sections of the population. You might think it's a good thing, but it's not. SARS-CoV-2 can spread largely without being detected, until it reaches old hosts and destroys them. If the symptoms are a bit severe and detectable in the early stages, the virus may have a harder time reaching its old targets. This means that young people are immunocompromised, but some of them have died from the virus. According to our current understanding of the epidemic, it is something we still do not fully understand, and relatively fit and young people should not develop more serious symptoms. A large part of the big question of how the virus affects different people in different ways, the answer to which is very important to prevent diseases that can be fatal in the future. Despite the somewhat lengthy list of COVID-19 epidemics we still do not know, we know that it came from animals. As potential suspects in pangolins, bats and chickens, there is still intense debate as to exactly which animal it is, but we speculate that the researchers will reach the animals once they are done with humans. What worries scientists, however, is how the mutated, human form of the virus is now being transmitted back to animals, something no one could have predicted. Among wild animals, a tiger at the Bronx Zoo was recently diagnosed with COVID-19 strain and several others began to show similar symptoms. This is not the only case of its kind, and domestic pets are involved in all other cases of human-to-animal transmission. This is the first time that SARS-CoV-2 strains have infected animals, and no one is sure how. Our best guess is that it came from an infected zoo worker with no symptoms. If so, it should have been given to other animals as well. No other animal, even the other large cats, have not yet shown any symptoms, so it seems to be affecting tigers for some reason. It is true that the COVID-19 eruption had an unequal impact on the first world, which means that the world's best healthcare specialists are currently working hard to understand how it works. Sadly, the SARS-CoV-2 strain has proven to be more difficult to understand than we thought, so it doesn't make much sense. At the heart of the problem is the big question of the basic biological structure of the virus. We know that it has the shape of a spinning ball with spikes intended to break into living tissue, and it remains a mystery exactly how it translates to the unrealistic high rate of its spread. Strain, there is a possibility for that too. We do not know what causes the SARS coronavirus family to be so deadly to humans, or how we will ever affect humans, even if we come a little later. The question remains as to how humans learn to infect the SARS-CoV-2 strain virus, but the biology of the virus helps us to better understand its effects. We are not strangers to the coronary viruses that infect humans, and they always need some time to learn to mutate and infect new hosts. The last SARS strain, also known as SARS Classic, took some time to mutate in the human body before real damage could occur. However, since the current virus has not changed significantly from the beginning of the epidemic, it seems that he knew how to infect and kill by leaving. This means that it is not distorted, but no mutation has been able to dominate the original one. Leave it this way. The current SARS-CoV-2 strain does not need to be modified to infect more hosts, yet, as it can already be done without much effort. Although we struggle with tens of thousands of events worldwide every day, doctors face a new unexplained problem. Many patients who have previously been diagnosed with a negative condition are now being tested for a positive condition and are questioning the methods and tools we use to identify it. While it is true that the virus can remain inactive for some time before showing any symptoms, almost every country is considering it before releasing suspected patients. According to World Health Organization guidelines, which have now been discredited and refunded, all cured patients should be tested twice for a negative test for the virus, with an interval of at least 24 hours between tests. With regard to some of the cured patients, they are now being tested for positivity for the virus, and we have no idea why. 7. According to some experts, the virus may have the ability to inactivate and reactivate in a human host, but patients may be reinfected from other sources once it is released, or something else. We do not know. However, all those abilities fly in the face of the popular belief that cured patients have some form of immunity to the virus. It also works in many other diseases we know of. It strengthens the collective immune system. Total population. Moreover, if the virus can be reactivated on its own, what does cure mean? If you study the various epidemics in history, you will understand that the secret of the success of the Chinese virus is that its high rate of spread is not fatal. We have dealt with more deadly diseases than we have had in the past. It is close to Black Death or Spanish fever, and the death rate or infection rate is nowhere to be found. However, it is different in one way: infected people can live their lives mildly or without any symptoms, and it can reach more people than those diseases. It really does create a society full of typhoid viruses, or more appropriate coronavirus currencies of our time. What scientists do not know is how many of these cases there are. In this case, it is clear that known infections or popular hotspots alone cannot be responsible for the Great Flood. Although there have been many cases in which mild or asymptomatic patients have been tested positive for the virus, we have only been able to test them. People with a runny nose or cough do not think it's a big deal, and according to many doctors and scientists, they may be the main reason why the virus spreads so fast. There is no news that the coronavirus novel affects everyone differently. Mortality rates are relatively high in older people and are characterized by their weakened immune system. While you may not think the virus is almost ineffective for children, it seems like an intelligent explanation. Compared to adult fatalities, the number of deaths among children, thankfully, is negligible. 10. That's good news, and it's indescribable. In fact, children are generally at higher risk for respiratory viral infections such as the flu. But many more people who expect a better mechanism to fight the virus are more likely to die from it than children, and we have no idea why. In this case, we have a good idea of how the coronavirus novel kills its victims, although many of the conditions leading up to that point are still a mystery. We still do not fully understand, but how can anyone recover from it? Usually for other diseases, patients are cured by producing antibodies that not only get rid of the present disease but also protect their body against future attacks. Unlike the influenza virus, that immunity may not be permanent, but there are still some signs that the body is fighting the disease. This is not the case for a large number of cured COVID-19 patients, and researchers are struggling to understand why. In one study conducted in China, most of the findings produced antibodies specifically intended for the SARS-CoV-2 strain, which we expect to be active. However, 30% of patients had no signs of the same or other associated antibodies, and it is not clear how their bodies recovered. Although the number of patients worldwide is growing at an alarming rate, at least we are able to trace the potential sources of the virus. Knowing that a hospital is a hotspot can help quarantine and isolate the area, contact everyone around you during an epidemic, and ensure that it does not contribute to further infections. Sadly, we also see a number of chaotic situations around the world with no way to get infected. In one case, a small child, 13, in Gujarat, India, became infected and died. One man in California, 14, became the first American to become infected with the virus without contact with any potential host. Many countries around the world are doing their best to prevent the infection rate. However, it is all based on the assumption that everything we know about the virus is correct. As more and more research shows us, we know very little, that if we have the opportunity to fight this, our prevention methods will have to constantly evolve. The biggest mystery of the COVID-19 epidemic is that we have no idea how it spreads, and it would be dangerous to speculate to anyone who says they do. Although previously believed to be transmitted by physical contact, new research shows that the virus can stay in the air longer than previously thought, and that carriers such as cough drops do not need to spread. Although always at a distance from each other, the entire choir can be infected with the virus. Again, our best guess is that it came from the air. We are not yet clear about all the ways it can spread.